Hey you guys, it's another week of Work It Out Wednesday, so let's work out one of these questions, okay? This week's question says, Miss Hudson is a 59-year-old female who is being assessed for anemia. The patient complains of weakness, paresthesias, dizziness, and change in gait. Their hemoglobin is 8.5, hematocrit 24, MCV 110, and their MCHC is 34. How should the nurse practitioner diagnose? We know that we always look at the stem of the question first to be sure that we're truly answering what they're asking us. So the stem of the question says, how should the nurse practitioner diagnose, right? And so let's highlight that stem real quick. How should the nurse practitioner diagnose? So anyway, this week I did a YouTube video on anemias, my 2-1-2 rule. If you have not seen it, don't continue to miss out. Go and look at it. It's on the YouTube channel at the Nursing Studio. Look at the anemia video. It will help you answer questions like this and help you prepare for practice as well, okay? But anyway, let's talk about it. So what do we have here? The patient has paresthesias, weakness, dizziness, change in gait. Those are neurologic deficits. So that's something you want to keep in the back of your mind. But let's look at those lab values. So the hemoglobin and hematocrit are low, right? So that's letting you know they are anemic. The MCV, which looks at the cytic version, which is the actual color. Cytic is 110, so the normal version is 80 to 100. So cytic, that means it's macrocytic because it's greater than, macro is larger, right? And then we have the MCHC, which is our chromic. Looking at the color, is 34. The normal range is through 31 to 37. So that means that it's normochromic. So then you want to do, if you know my 2-1-2 rule, in that higher range where we have macrocytic, normochromic. So macrocytic, normochromic, there's two that falls into this category. We have B12 deficiency anemia and we have folate deficiency anemia. And then I taught y'all in the YouTube video, or those who have taken my review, I've taught you guys how to differentiate between those, right? So with B12 deficiency anemia, you have those neurologic deficits, you have that beefy red tongue, whereas with folate deficiency anemia, you don't. So here, this person is described with having neurologic deficits, right? So you want to look for that B12 answer. So A, cis iron deficiency anemia, nope. It doesn't fit that microcytic hypochromic range. Thalassemia falls into the same category, right? Microcytic hypochromic. B12 deficiency, ding, ding, ding. The answer is C. And then D, folate deficiency anemia also falls in this range, but it does not have those neurologic deficits. So be sure when you're answering anemia questions that you know how to differentiate between the two, okay? All right. Meet me back here on Wednesday. Matter of fact, beat me here.